Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is New Year's Resolution to Improve Your Infection Control and Immunization Efforts. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is Commitment to Excellence, an Introduction to the Nursing Home 5-Diamond Patient Safety Program. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to briefly introduce our nursing home team. We have several of our quality improvement specialists here today: Deborah Wright, Penny Imes, Patty Austin, and Shirley Sullivan. We're also joined by our infection preventionist, Jennifer Brown, and Quality Insights Medical Director, Dr. Jean Storm. For today's webinar, our panel is here to take your questions about improving infection control and immunization efforts. So if you have a question, please submit it by using the chat or the Q&A tool in your Zoom menu. And you can also raise your hand to request to be unmuted to ask your question out loud. And to kick us off, our panel will also be sharing their own New Year's resolutions to help our nursing home partners with their infection control and immunization efforts. And our first up to speak is Patty Austin.
Hi, everybody, and as Kathy said, welcome. We at Quality Insights are thrilled to kick off the new year with all of you, and this season is filled with opportunities to reflect, revitalize, and set some ambitious goals for the months ahead. The new year kind of represents a chance to revisit projects that might have been set aside, embark on some new initiatives, and focus on those areas that demand our attention and care. At Quality Insights, our resolution for 2025 is to collaborate closely with each of you to meet you where you are and support your efforts for achieving your own resolutions. Together, we're going to turn challenges into successes and ensure that progress is both measurable and meaningful. This year, our resolutions are all rooted in the QAPI process. That's going to serve as the foundation for all of our efforts. Starting in just a few weeks, we're excited to launch a series of micro-learning sessions designed to help you put the QAPI process into action and address specific improvement areas within your facilities. Given the critical importance of infection control, each 15-minute micro-learn session will feature a fictionalized team of nursing home staff applying the QAPI concepts to a realistic infection control challenge. These sessions are designed to be concise, practical, and engaging, making it easier than ever to integrate new knowledge into your daily operations. We're calling the 4-week series Back to Basics QAPI Infection Control. Starting on January 22nd, you'll gain actionable insights to strengthen your infection prevention efforts while re-energizing your approach to quality improvement. We really hope that you'll join us for this innovative and impactful series. Now I'm going to pass the ball over to Jen Brown, our quality improvement infection preventionist, who's going to tell us what's on her agenda for the new year. Jen?
Yeah, thanks, Patty. So as the new year begins, it's time to embrace fresh goals and recommit to strengthen our infection control programs. And just like with our personal resolutions that help us focus on health and growth, professional resolutions can guide us towards safer and healthier nursing home environments. So some of the resolutions that your team can use to start 2025 off strong is conducting a thorough annual risk assessment. This year, let's resolve to begin with a deep dive into our infection control data, completing an annual risk assessment, which allows us to identify vulnerabilities, analyze trends, and prioritize efforts. By evaluating last year's surveillance data, your outbreak reports, and facility metrics, your team can craft an updated infection control plan that's tailored to your residents and your staff's needs. And this proactive approach sets a solid foundation for the new year. Another great resolution is to commit to continued education for infection preventionists. Education is an important way to help ensure that your infection control program runs smoothly. Make professional growth a priority in 2025 by participating in professional organizations, keeping up to date with current events in infection control, and also participating in education sessions like the Quality Insights Infection Preventionist Leadership Bootcamp. This program provides IPs with vital knowledge, actionable tools, and supportive community to navigate infection control challenges confidently. We're currently holding a boot camp in West Virginia nursing homes, but there's an upcoming boot camp for Pennsylvania nursing homes on January 28th and 29th. And Kathy is going to paste a link in the chat for how to register for the Pennsylvania boot camp. If you're unable to attend the current West Virginia boot camp, we will have an on-demand version coming soon. So if you want to be notified when that's available, you can let us know by clicking yes on the poll that's Kathy's going to be launching soon. Oh. So by prioritizing education, we empower our infection preventionists to lead the charge in creating safer environments for our residents. Let's also resolve to think outside the box when it comes to infection control education. One innovative approach is our infection control escape room, which we're partnering with the Pennsylvania Project First Line with. That turns key infection control concepts such as hand hygiene, PPE, respiratory hygiene into an engaging team-based challenge. And this interactive experience not only reinforces critical skills, but also builds enthusiasm for infection control practices among staff. So if you're interested in learning more about the escape room, please reach out to me after the webinar and I'll help you get one scheduled. So by committing to these resolutions, we can renew our dedication to preventing infection, safeguarding residents, and supporting our staff. So let's make 2025 a year of renewed commitment and progress in our infection control programs. And with that, I am going to pass it on to Penny. Penny, what's your New Year's resolution?
Well, Jen, as I ended up with a Happy New Year's cold this year, because somebody somewhere wasn't practicing good infection control prevention, I believe that the new year is a great time to focus on infection control education for everyone. Incorporating the QIN-QIO theme into infection control is really a great way to help educate all facility staff, because QIN-QIO does depend on a team-driven approach to implement processes and practices that will help us reduce infections such as pneumonia, influenza, COVID-19, and the common cold. Infection preventionists can really help lead the way in being champions and resources for your facility staff. So ensuring that all your employees understand how they can contribute to the prevention of specific infections by practicing infection control and encouraging appropriate immunizations, which I did have, should be a priority for the upcoming year. In fact, I'm very glad I had that flu shot this year. So Quality Insights is going to continue to work with small groups of facilities as well as our individual facilities to help you understand how to implement those QIN-QIO-driven infection control practices. We're going to continue to offer educational resources that you can share with your staff as they focus on infection control and immunization to help protect your residents. We really would like to ask all of you to resolve to continue to participate in our weekly webinars and other exciting new educational offerings, and to access our website for resources. Our Quality Insights team has resolved to be here as a trusted resource to assist you, so please don't hesitate to reach out as needed. And I'm going to pass this over to Shirley to find out what her New Year's resolutions are.
Thanks, Penny. Welcome, everyone. As we continue our focus on infection control in this new year, this is an excellent opportunity to expand the education we provide to staff and extend this to residents. Empowering residents with the knowledge and tools they need to help prevent the spread of germs is a vital step in maintaining a healthy environment within your facility. To support this initiative, Quality Insights has developed a helpful high-end hygiene resource for residents. This resource can be included in your admissions packets, making it easily accessible to new residents, and it can also be used by staff to educate residents on proper hand washing techniques. Additionally, we have links to visually engaging posters on hand hygiene and cough etiquette, featuring simple phrases and clear images. These posters are perfect for placing in hallways and other common areas to serve as helpful reminders and for educational opportunities. They can also be useful in educating residents with dementia, as the visual cues are designed to be easy to understand and follow. We encourage you to take advantage of these tools to reinforce infection prevention strategies and to create an environment where everyone plays a role in promoting health and safety. And now I will turn it over to Deb. And what else is Quality Insights working on for the new year?
Deb, you need to
Muted.
unmute yourself.
Thank you. As we step into the new year, we're all looking at different resolutions. So if you're considering a New Year's resolution to enhance your facility's educational initiatives and strengthen your culture of safety, particularly around those infection control and immunizations, Quality Insights shares that same goal with you. We are excited to introduce the long-awaited Nursing Home 5 Diamond program. That's what we're calling it. It's an automated online educational resource designed to improve patient culture of safety in nursing homes. This program features a series of modules covering key areas such as infection control, proper medication use, reducing hospitalizations related to infections, and so much more around infection control and immunizations. And there'll be more added as we move through this program. Each module is accompanied by tools and resources to help you implement these safety concepts with your staff. This is a nationwide program that our end-stage renal disease network has done with a number of nursing homes and dialysis units. So we're excited to get it out there to the nursing homes at the facility level. So for each module that you complete, your facility will they'll earn a diamond. And after completing 5 modules with your staff and a program review questionnaire, your facility will be recognized from us as a 5 diamond patient safety facility. So next week, we're going to be doing an in-depth look at this program. We're going to have a live demonstration of the program and explain to you how it works. So Kathy's going to be dropping that link in the chat that you can register for that. Share it with other staff that maybe don't regularly attend these webinars, but you think that they would be interested in seeing what we're going to be doing next week with that. In addition, many of you have participated in our vaccination campaigns over the last 6 to 9 months, and we're excited to announce that we'll be starting our 2025 vaccination campaign again. This is an opportunity for you to have us arrange for a local pharmacy to come into your facility to administer vaccinations that you already have received consents for. So what will happen is you'll let us know what vaccines you need. You'll have the consents for them. We'll arrange for a local pharmacy to come in. They will administer the vaccines. You'll be there to ensure resident identification, do any facility charting that you have to do with that. And then the pharmacy will do all the billing aspects of those vaccines. And any costs that are not covered by the residents or the staff's insurance, and I'll have to do the disclaimer, unless the residents are in their Part A coverage stay, which, as many of you know, you need to follow those Part A billing guidelines. But going back to the original statement, any costs that are not covered by the residents or staff's insurance will be covered by us. So we know that many of you are struggling sometimes to obtain the vaccines due to financial constraints, and we want to help reduce some of that burden for you. So you all will be receiving an email in the near future explaining this program and asking if you'd be interested. But in the meantime, if this is something that your facility would be interested in learning more about, please feel free to email me at the email that Kathy's going to be putting in the chat, and we will certainly help get you started on that. So now that we've shared all of our resolutions and how Quality Insights looks forward to continuing to work with all of you, let's hear from our medical director, Dr. Jean Storm, to see what she has planned for us.
Hi, everyone. And I got really excited listening to all the plans for this year. So I just wanted to wish everyone a happy new year. And as we have heard, Quality Insights is ringing in 2025 with fresh opportunities to reflect, rejuvenate, and collaborate on our shared goals. We have the same goals that you do. We're focused on a QAPI-driven approach. QAPI is something that is near and dear to my heart, as I've often said, starting with an exciting series of microlearning sessions that tackle infection control challenges in a fun and practical way. We all need to have more fun in our lives and in our work. These sessions are designed to help you seamlessly integrate improvements in your daily operations, all while keeping things engaging and relevant. And let's not forget about the importance of a deep dive into infection control data to identify vulnerabilities and create tailored strategies for the year ahead. This year, we're also emphasizing continued education for infection preventionists. They are the frontline warriors in our facilities, encouraging professional growth through programs like the Infection Preventionist Leadership Boot Camp. I attended one in person, and I highly recommend these boot camps. For those looking for something more interactive, our Infection Control Escape Room offers a hands-on way to boost team skills and enthusiasm. With a focus on empowering both staff and residents, we're rolling out new resources like hand hygiene and cough etiquette guides to promote a healthier environment, something that's very important with all the viruses and bacteria that are going around in this season. Finally, we're launching the Nursing Home 5 Diamond program, as you heard Deb talk about, something that I was very involved in, as you'll hear my voice on many of those modules. It's a unique opportunity to strengthen safety cultures, which is something that is very important with educational modules and resources. And there's many modules about infection control and multi-drug resistant organisms. So very relevant topics to your day-to-day practices in your facility. So let's make 2025 the year of growth, engagement, and progress in infection control.
Thank you, Jean, and thanks to our whole team. Now we are going to move on to the live Q&A portion of our webinar. So if you have a question or comment, please submit it in the chat or using the Q&A tool. And you can also raise your hand if you'd like to ask your question out loud. And while we're waiting, I'd again like to invite everyone to next week's webinar. As Deb mentioned, this is going to be an introduction to the Nursing Home 5 Diamond Patient Safety Program. So if you're interested in joining us, that will be next Wednesday at 2 p.m. You can find the links to our webinars in the newsletter we send out every Friday called the Last Minute, or excuse me, every other Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at caudill@qualityinsights.org and I will get you on that list. And for people who are added to that list, we also will send out the weekly invites to the webinar every Wednesday. And now I'm going to drop my email in the chat and I'm going to look to see if we have questions. It looks like we have a couple. The first one says, when can staff return to work for staff after COVID-19 infection?
Yeah, I can answer that one. When determining when healthcare personnel can safely return to work after testing positive for COVID-19, it's really important to follow CDC guidelines and also consider the individual's symptoms. Another thing to consider is their testing status and the risk of transmission within the facility. Generally, though, Staff can return to work after at least 7 days have passed since the onset of symptoms if a negative test is obtained within 48 hours prior to them returning to work. And that is provided that they are fever-free for 24 hours without the use of any sort of fever-reducing medication, and that their symptoms are improving. Sometimes the cough can linger for a while, but if it's improving from what it was, that's okay. The time they can return to work is 10 days if testing is not performed. So if they didn't do any testing, they can come back in 10 days. Or if they had a positive test on days 5 through 7, then we'll just wait till 10 days. If the staff member, it has a really severe case or a critical illness, or if they're immune compromised, the isolation period is 10 to 20 days. And you might want to consult with their healthcare provider just to see when they're okay to come back. For those healthcare providers who are moderately or severely immune compromised, you can also use a test-based strategy for returning to work, which you can get a negative result from at least 2 consecutive respiratory specimens that are collected at least 48 hours apart. So a total of 2 negatives overall. And, again, given that they don't have any fever and their symptoms are improving, they should be okay to come back. When they return, make sure the staff is self-monitoring for symptoms and, look for reevaluation if they do, go to occupational health or consult with their provider if the symptoms that they were having recur or worsen. So just make sure your policies are up to date and address that return to work process.
We got a follow-up question to that, Jen. They asked, what if staffing level is what was previously categorized as a contingency?
There are contingency and crisis mitigation strategies that you can use, and I can share. I'll give a link to Kathy for those mitigation strategies. If you do have some staffing issues, there is a strategy to, a lot of different things you can do. But as far as the return to work specifically, you can reduce that time to 5 days with some testing. So I'll share the CDC link to those mitigation strategies, and you can, determine what works for your facility.
All right, thank you, Jen. And I'll be emailing this recording to everyone attending here today to the email address you used to register. So when Jen gives me that, I will include that in the follow-up email. And here's, I think, one more question. If anybody else has a question, go ahead and submit it at this time. This question says, when are residents able to come out of isolation after COVID-19 infection?
So for nursing home residents, the timing for ending isolation is slightly longer due to the higher risk of severe outcomes and transmission. So residents with mild to moderate illness can generally come off of isolation after 10 days from symptom onset, provided that, they don't have the fever and their symptoms are improving. If the resident has a severe case or if they're immune compromised, might require up to 20 days of isolation. And again, the test-based strategies are available. They're not routinely done, but they can be considered for immune compromised residents to confirm that the infection has resolved before you end isolation. So throughout the isolation period, though, facilities should continue to implement your infection control measures, like, maintaining those physical distancing, ensuring proper ventilation throughout the facility, encouraging staff and visitors to wear masks. And as isolation ends, the close monitoring of symptoms should continue, along with a gradual return to normal activities.
All right, thank you, Jen. And I think that is it for our questions. So I'm going to wrap us up, but first I'll ask our panel, does anyone have anything they'd like to add before we wrap up for today? We have one person that said they're unable to click on the link for the 5-Diamond webinar. I'll have that link in that follow-up email. It is the same as the link you used to register for today's webinar. It will be the one for today when you registered for the webinar on January 8th. It would be the one for the 15th. So if you have that link that you used to register earlier, you can use that. And of course, I'll include it in the follow-up email. Let's see. Is there a line listing that is to be used when you have COVID in the building?
A lot of facilities have different line listings that they use to track COVID cases. CDC does have a respiratory infection line listing that you can use. I think it was originally done for influenza outbreaks, but you know, for respiratory viral respiratory infections, it will work. So that can also be used. I can share that link with you guys as well.
Another question that I think is for you, Jen. It says, is close contact exposure testing still required?
So I'm not sure specifically close contact exposure testing. As far as I'm aware, the testing is not routinely recommended. I will follow up with you about that, but especially if, you know, there is a concern for exposure, you might want to implement your 135 testing for those people, you know, after the exposure. But the general, just routine testing for people, I think it's not recommended at this point. And Michelle, she did mention there's a nice toolkit that Pennsylvania put out, and that is a really good toolkit. And we can share the link for that as well.
Yes, and they reissued that toolkit last week. They didn't make any changes, but they reissued it, and we included that in the last minute lowdown. So if anyone has that email from last Friday lingering in their email in their inbox, we have a link to that toolkit that was mentioned. And then of course I can include the link to that toolkit in the email that we send out. And that would just, I believe, just be for Pennsylvania facilities because it's from the Pennsylvania Department of Health.
Yeah.
And I think that's it. Is there, oh, one more comment. Do you know if the COVID isolation period will be updated for staff/residents anytime in the near future? The CDC allows for people to return to work right away without a fever for the general population.
Yeah, that general population recommendation is just healthcare providers. There's a different set of criteria. And unfortunately, I'm not aware of any changes to that recommendation at this time. But if there are any changes, we'll definitely get that information. But right now, you know, it stands as it is.
All right. Let's see, I think that's the last of our questions, but we've had a lot of late arriving questions, so I might give this another minute just in case anybody else has anything else they'd like to add.
I'd like to throw a question out there to those that are on the call from Pennsylvania. I know at one time when you would do the your event reporting stating that you had your first positive case of COVID in the building, Department of Health used to have on that reporting site a line listing. Does anybody know if that's still, is that still the case? Is that what Ashley needs? Okay, so thanks, Amy. So Ashley, your line listing, when you do your reportable to Pennsylvania Department of Health, you should get the reporting line listing that Pennsylvania is requiring. So hopefully that will help you with that.
Yeah, making notes for all the things to include in that follow-up email. And of course, if you need to contact any of us, Deborah, we put Deb's email in there, my email, and I'm going to stick Jen's email in there too, if you have questions about infection control or immunization. Here we go. That's Deb's email, jbrown@qualityinsights.org. Or Jen's email. I think I said that. All right. I think I can go ahead and wrap us up for today, if that sounds all right with everybody else. Before we sign off, we'd like everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. And I'd like to thank all of our panelists for joining us here today and to thank all of you for joining us. And we hope to see you again here soon.